Association. So happy you're able to join us today. We're using this webinar series to do the kind of work that we would normally do under normal circumstances. We much prefer in-person meetings, but given the restrictions of COVID and the concern, and particularly now with a little bit of an uptick in some of the cases, we're going to continue the webinar series. What we do is engage our members, and we affect policy, and we're able to do that with this webinar series. Again, it's not our preferred method. We'd much rather be meeting in person, but we've found that we can get some good information out to our members and affect policy that's important to agriculture. Today, we're so happy to have Megan Ritter with the Indiana Farm Bureau join us to talk about the health benefits plan. You may have heard some about this effort throughout the legislative session. Over the past several years, a number of the ag groups, the Soybean Alliance included, I know pork was working as well, to just try to find some health benefit options for our members. And it was a real struggle. There just wasn't a lot of options. And Farm Bureau came to us and the other ag groups last December. Given their network with the other states, they were able to come up with a plan that would be good for a number of Indiana farmers, and asked for our support as well as the support of other ag groups. And we did offer that support, and we all stood together at the State House and was able to get Senate Bill 184 passed, and it's now Senate Enrolled Act. And Megan will get into those details, but just want to run through the agenda real quick. We will have some remarks from Angie Steinberger, Indiana farmer in Shelby County. And she's the vice chair of our membership and policy committee. Megan will give a presentation on the Indiana Farm Bureau Health Benefits Plan. And then we'll have plenty of time for Q&A with Megan as you get questions for that. Now we will have, unfortunately, we will have to use the chat feature. I'd much rather have just an open discussion, but the technology that we're using, a lot of times we get a lot of feedback, and it's hard to manage that flow. We don't want to discourage that interaction, but we do need to have you enter the questions on the chat feature that's at the bottom of the screen. Just type those in, and we'll provide those to Megan through the Q&A presentation. And a lot of times we found that if you are getting a lot of background noise, or if you're having trouble with computer audio, just call in so you can listen in and watch that on the computer. Next slide, please. So Angie Steinberger, again, a farmer from Shelby County, board member for Indiana Soybean Alliance and vice chair of the Membership and Policy Committee. Angie? Hang on, Angie, we're having a hard time hearing you. We can hear you are speaking, but we can't hear you. So I don't know if you're too far away from the microphone or what.
Can you get closer to the mic, Angie? Yeah, a little closer. Still kind of hard to hear.
I'm just happy on behalf of the Indiana Soybean Alliance to welcome everyone today at the Indiana Soybean Alliance proves the viability of Indiana farmers through checkoff membership and policy programs. We do this in a number of ways. Through the checkoffs, we develop new soybean-based products that will expand the use of our soybeans that we produce in Indiana. We also look to expand markets for corn and soybeans, as well as corn and soybean products. That might be something like biodiesel, ethanol, or meat products. We also finance research to improve sustainability and increase yields, as well as educate consumers on issues such as rural infrastructure. On the policy side, I know Steve works at the state and national levels to help educate legislators on the issues that affect us in the farming community, such as healthcare that we're talking about today and roads and bridges. We also love the for improvements on the issues at both the national and state level. And with that, I'd just like to thank Indiana Farm Bureau who allowed us to partner with them on providing a healthcare solution for farmers. I know it's a big issue here on the farm, and we appreciate their diligence. Thank you.
Well, thank you, Angie. And again, you said it well. We thank Indiana Farm Bureau for taking this lead to provide this option for farmers. And again, we solve we get a lot of the same questions from our members. It's, there's just need for additional products for farmers, healthcare products. So next slide, please. I think perhaps we're ready to bring Megan on. So
Yep.
Megan, thank you so much for joining us, and we'll turn the presentation over to you. I think we're going to allow you to share your screen, and you can go through your presentation, and then again, we'll have plenty of time for Q&A after Megan's presentation. So Megan.
Thank you all. Thanks for having me. I'm really glad to be able to share a little bit of information about where we've spent our time over the last several months and what we've been doing since the legislative initiative. But I would echo the same sentiments that it's been a lot of fun as an organization to be able to partner with our allies and our other ag organizations to really to come together behind this kind of an initiative that really will help Indiana's farmers and agriculture in general. So we've been very busy, but for a work that's really a lot of enjoyment and something that I think is going to be a great benefit. So what I thought I'd do this afternoon is start with kind of a level the playing field if you haven't been following along. And maybe you haven't been as involved in the legislative side of things. So I thought maybe I'd level the playing field a little bit and start with a little bit of the background. And how we got here was really, as Steve and others have already, and Angie already mentioned, this was a grassroots initiative that was really surfaced by the membership over the last several years. And whether that was the pork producers organization or the corn or the soybean associations, there was a growing sentiment within our memberships and within the farm community that there weren't enough options, that the options that were available were getting more expensive every year, and we really needed to find a workable solution. And so we spent 2 years almost researching what options were available. I know the other ag organizations put resources into that research as well, and maybe even their own research. And what really we focused on was trying to find a solution that addressed the challenges that were really unique to the agriculture community. And so what we did was we came up with really 2 options. And at the end of the day, one came to the forefront, and that was being able to address the needs of the ag community by offering something that's more affordable, as well as getting down to the working owner and that employee, really that farmer without employees. So those were the things that we were trying to address in this initiative, and felt like we really had to address in order to be successful. And through that research and finding those goals and really honing in on those, we realized that in order to meet those objectives, we needed to have a legislative solution. And so we worked successfully with our partners to work with the legislature and the General Assembly. Senator Charbonneau was a great champion. I know that if you visit with him, he's extremely proud of the work that he did to author the Senate Bill 184, as is Representative Manning. He went to bat and really stepped up in a huge way. And they both achieved really overwhelming bipartisan support in both the House and the Senate. This is not a unique, there's been a couple of other states who have tried this kind of a legislative approach, and by far, Indiana has had the most bipartisan support in our General Assembly, and it was just a really great effort by two really strong leaders in the House and the Senate. And so what the legislation does is allow us to offer an innovative solution that will allow us to offer that more affordable product. And so I'll get into some of those details, but it really offers us a unique option that wasn't on the table before. I'll mention this briefly. Members, farmers from around the state were extremely involved and engaged in this process, and their involvement was critical. Farmers were at the State House nearly every day, and I think Steve is probably in that picture somewhere down there in the Senate testimony. And we really all came together to work at the State House this legislative session to make that happen. So what have we been doing since the end of March? And we've been really focused on the delivery of Indiana Farm Bureau health plans and creating the plans that will be offered to our members. And those details will become more available in the coming months. But a few dates that you're going to want to make sure that you're aware of. Plans will start to be available in October. We're going to start putting together rates and benefit sheets, and you'll be able to get those in September. And then come October, we'll be able to start accepting applications, and then plan benefits will begin January of 2021. Part of the legislation was that they really wanted to make sure that we weren't going out and marketing these plans to new folks. So one of the caveats is that you have to be a member for 30 days in order to apply for the plans. And so we're going to stick very strictly to that. And so if you're not currently an Indiana Farm Bureau member, you would need to be a member for 30 days before you could apply for those plans. We're going to be offering 3 separate options for those plans. We're calling it the traditional under 65 plan. This is, I've heard it referred to Back to the Future. These are the kinds of plans that you might have been able to see on the marketplace a little bit more consistently before the Affordable Care Act went into place. And so we're going to have 4 different plan options under that traditional under 65. We'll have an advanced choice, classic choice, a major medical plan, and a high deductible HSA plan. So those plans will be both individual and family plans. There will be different levels of deductibles, and several of those plans actually already have dental vision included in them. So there will be some choices and options for people to make in those under 65 plans, but you do have to be a member for 30 days in order to apply for those plans. Medicare supplements, we will be offering those in that over 65 market. These are also known as Medigap policy. They are designed to fill that gap in the original Medicare options. And these policies are really standard across the industry. So no matter if you get them from Farm Bureau or you get them from somewhere else, the plans themselves are consistent. What is going to be different is the price and the service that you get. So we currently offer Medicare supplements now. So if you happen to be in that marketplace today, we could talk to you about that. But all of those plans that we are offering today, we are going to refine those offerings as well as relaunch under the brand Indiana Farm Bureau Health Plan. So if you currently have a member's health plan through us, a Medicare supplement plan, it will be rebranded come the first of the year. And then we're going to offer a dental vision bundle. This will be both of those options together, a really great price point. And again, you could put those with another kind of a plan or either of these the traditional plan or the Medicare supplements. But you do have to be a member for 30 days in order to apply for that plan as well. Starting to get into a little bit more of the meat and potatoes. The plan delivery. So what does that look like? This is really important when we went and are trying to find what does that provider network look like. We needed to make sure that we have a robust network of providers really across the state, particularly coverage in rural areas. And so one of the things that we've been able to benefit from is this innovative, unique partnership with Members Health Insurance Company that's part of Tennessee Farm Bureau. And they've been providing these kinds of member benefits for over 70 years. So this partnership has really allowed Indiana Farm Bureau members and will provide our members access to plans that really were offered prior to the ACA, as I mentioned, at substantially lower rates than what they can get on the marketplace today. The network that we're going to be using is the United Healthcare Choice Plus network. And then the dental plans will use Delta Dental, and the vision plans will be offered through VSP. So hopefully you've had good experience and you can find good coverage in those areas, and that was important to us. In order to get access to the plans, there's going to be a couple of different ways that you're going to be able to purchase and get additional information about the plans. Of course, one of the things that we are trying to do is keep costs low. And so in order to do that, we are going to offer some great user-friendly tools for our members. And so online will definitely be an option, as well as a customer service phone line. And so those are two great options that really will help provide a great customer experience and a member experience for us. And of course, it wouldn't be, it goes without saying that we're going to have some great information also available to our members at the Farm Bureau offices. So we have offices in all 92 counties. And so agents and marketing associates for Indiana Farm Bureau Insurance will have additional information and be able to provide some guidance and quote some policies as well, and help members understand what those plan options really are. So county Farm Bureau offices will always be a resource for members as well. Important dates to remember. I think that these are some things that you want to think about as we roll into the next couple of months. Medicare supplements, those are available now. So we can provide additional information to you about that now. Rates and plan options will start to be available in September, and then applications will be available in October, and then benefits will begin in January. So that kind of lays out the timeline for you and give you a little bit more of a high-level overview of when to start looking for certain details and information. Some of the things that end up, and if you've heard me talk about this before, you'll hear me say this often, is that there are some misconceptions from time to time as we offer these new plans. And one of those is that the plans aren't for everyone. I think it's gonna be a great option for many, and that was part of our goals and objectives in launching these new opportunities. However, not everyone is going to qualify. And so one of the ways that we are going to be able to keep the cost lower is by providing those health assessments. And so you won't be canceled if you get sick. And once you've gone through that one-time underwriting and you get placed in your band, we won't raise those because you get sick or cancel you because you get sick. As long as you're paying your membership and your premium, you'll be able to keep your plan. But we do have to have that one-time health assessment in order to keep the cost down. And then we will offer a broad network. We know that is important, particularly in our rural communities. And so that is a primary goal of what we're trying to accomplish. And at that point, I think that's a pretty good overview of where we're at, and I'm happy to answer any questions that you might have, and see if I can answer them all.
Okay, again, thank you, Megan. And if you do have a question, please enter that into the chat. And then we'll relay that to Megan for response. One question that I have is, you do have to be a Farm Bureau member, and that's pretty clear. Now, you don't necessarily have to be a farmer. Is that correct? Or you have to be a sole proprietor? Can you explain a little bit kind of what that category of folks is? You may not have to be a full-time farmer to participate.
That's right. You just have to be a member of Indiana Farm Bureau to gain access to the member benefit. Those are contracts. That was one of the reasons that the legislature felt strongly about that membership as being part of that option. So we have the ability to have memberships that are non-farmers. And so as long as you're a member of Indiana Farm Bureau, our membership dues are $32.50 a year. You can have access to this member benefit.
Well, I think that's, on the surface, you may think, well, it's not for farmers, so is it really that important? But it really is, because in rural areas, we rely on a lot of non-farmers to operate our businesses, whether it's the chemical dealers, there could be a sole proprietor that's a chemical applicator that may have some struggles gaining health coverage. So I think it's good for rural Indiana, not just specifically for agriculture, but obviously if it's good for rural Indiana, it's good for agriculture. But I think that's an important piece of this, that it's that others could, and we rely on folks outside of agriculture that may need this option. And I think it's again, it's not going to, not everybody would qualify. My guess is, and correct me if I'm wrong, Megan, but my guess is younger folks would probably have a better chance of qualifying, just simply based on underwriting. Not necessarily. I mean, it's not necessarily a certain age group, but chances are, if you're younger, you're better chance of qualifying. And I think that's great, because that's a segment that we need to be bringing into production agriculture. And I know a lot of folks, that's the determining factor, how engaged they can be on the farm, if they, because they may have to work off the farm to gain access to health coverage. And if this may encourage more younger people to be more engaged on the farm. So if you got any thoughts on that, Megan, as far as the category of folks?
Absolutely. We know that we've heard from members who they could really use spouses' help back at the farm. They could grow their farm if they didn't have to go and take a job in town to get health insurance. So we've heard numbers of stories of that. Because of this relationship with the other state farm bureaus, there's a couple of states who have a little bit of history. We are confident that more than 8 in 10 applications will be accepted. So that's the history in the other states. We would expect that will be that will be ours as well. So that's a great rate. We think it's going to be more than 8 in 10 who apply will get offered coverage.
We spoke about this prior to the webinar. It'd be nice if we had all the information ready. However, I think there's some value in kind of getting a little bit of this information at a time. It's going to be, something that you want to make sure you understand fully before you get into, make sure it's a, good option for you. So I think it's good that we're able to get some of the information out now. And again, of course, you got the timeline. We're going to be taking applications, and do appreciate you being able to provide the information that you can now. Rachel, I believe you said you had some questions for us.
Yep, I've got questions in the chat. Okay, first one, Megan. We have an employee who lives in California. Will the medical plans offer major network options for folks that don't live in Indiana?
If that's an individual plan, you have to be a resident of Indiana to apply.
Next question, will the one-time health assessment take place along with the application process?
Yes, so what they will do, depending on your age, at the time of application, we will ask for you to gather some health records and then put those in as part of the application process. That ensures that the process is as seamless as possible, and it really ensures a much quicker response time. So there will be some medical records that will need to be submitted with that application, depending on your age.
A somewhat related question, when the information becomes available to review in September, will there be like a list of disqualifying conditions or pre-existing conditions that, you know, they know are going to be rejected?
So from that standpoint, I think that there's very few things that are going to just outright. I know this question comes up a lot. I have this, does that disqualify me? So, you know, even if you have a health condition, you still may gain benefit from the plan and the plan options. And so there's not a particular list that says this is exactly what. So it's a combination of a number of different health factors that will depend your rate band. So I really think that at that point in time, it will be beneficial to talk with someone in a county farm bureau office. And there's some preliminary health questions that will be able to be offered in our quoting system that will give you a little bit of a rough estimate of what that will look like. So there is not a, oh, you have this and you're going to be rejected. And so many people who have pre-existing conditions will still be offered coverage. So that's important to note as well.
Okay. This is not a question, this is just a comment. Julia Wickard says, thank you for being big and being bold with this initiative for Indiana farmers. The next question is, can you give a high level look at costs relative to other Cadillac plans in Tennessee?
I can't, not today, I can't. What I can say is that when we went into this initiative, we set a baseline goal, right? Affordable was part of the goals and objectives of launching this initiative. So we knew that we'd have to have savings. The baseline that we were looking at was a 30% savings on ACA plans without subsidy. So we're feeling really good about where we're at with those goals. There's still some actuarial work that's yet to be done, but I think that everything that we've been working on indicates that we're going to be able to meet or exceed that goal.
Can you change your Medicare supplemental carrier?
So if you currently have a Medicare supplement plan, can you change to us? Is that the question?
I think so. Let me send a confirmation.
Okay.
Yes.
Yes. Okay. So you can. There's certain periods of time in which you need to do that. So there's enrollment periods that but yes, you can. There's just some restrictions around when you can do that with those Medicare supplement plans. Those are insurance, so they're more regulated. This is, and kind of going along with this, because this is a question that we get. We're launching during the traditional health plan open enrollment period, but if come February or March or June of next year, you find yourself in need of a health plan, you can apply at any time. So we're not going to have the restrictions of an open enrollment period. And so that's something that I think is important for people too.
How does this program work when we are on Medicare, but our sons are in the operation and our employees are in the operation?
So they're individual and family plans. So each individual or family would have to apply for those plans. So these are not group plans. These are individual or family plans. And so there's a lot of different combinations of how these plans could benefit, even if you have more than a couple of employees, or you've got family situations with different kinds of dynamics and structures. So it'll be important to ask those questions of us when those plans come out, because I think there will be some options depending on that makeup. So the other question that has come up in that situation, maybe the farm has only one membership. So you have to be, each individual or family needs a membership attached to it. So if you currently have a membership for that farm operation, but you have multiple people as part of that farm family, then each family is going to need a membership. Not everybody in the family needs a membership. Of course, we'll take those, but each family will need one.
And there was a somewhat related question that you kind of answered, just asking if there is a family plan option.
There is a family plan option. There will be multiple family plan options. Yes.
Okay. If your spouse is already provided insurance through their employer, does that hinder eligibility through Indiana Farm Bureau?
It does not. So in some cases, what we've experienced is that maybe one spouse does have an employer plan, but those employer plans have become much more expensive. So or maybe they don't offer coverage to the entire family; they just offer the coverage to that employee. So yes, that there is still an option for that family to benefit from these plans.
Are there occupation restrictions in place, such as being an aerial applicator?
Not that I'm aware of.
If we are already on an AARP United Healthcare Medicare plan now, will we want or need to change to a Farm Bureau plan?
That would just be your choice. So if you could compare, again, those plans themselves are going to be identical. It will just be cost and service that would separate us from those Medicare supplement plans that they're getting through AARP or another provider.
Sorry, I'm answering as well as getting ready to ask. So just to clarify, even if you are yourself provided insurance through your current employer, you can still choose to go through Indiana Farm Bureau.
Yes, you can still apply and choose that as an option. Now, the other thing that you can do, and I've answered this question a couple of different ways, the employee may still decide that could be. This kind of goes back to the question about we're on this, we're in Medicare age, but our employees are. So there might be a lot of different combinations of what could work best for your family. So in one situation, it may be most economical to keep that employee on the employer plan, but then price out the rest of the family on a Farm Bureau health plan. You still may save more with 2 deductibles than you would by adding your family to your employer plan, or maybe putting that person that has the option of the employer plan back onto the Farm Bureau plan. So there's a lot of different scenarios that we could help work through at that point of application to find out whether or not which one might be the best from either a deductible standpoint or from a cost standpoint or plan options.
Will current Farm Bureau members get a list of the plan options before the application process begins? Or is that, I think they're asking if that's something they need to request, or if members are going to get notified, hey, here's the plan options.
Sure. So we will be launching a new website, infbhealthplans.com, and members can actually go to our website today and fill out a form that indicates that they're interested in getting additional information. So you can call me. You can fill out that form, but members will have access to that website, as well as be able to, they'll have those plan options available to them in September. I know that county farm bureaus are looking at hosting events, and as well as putting information out for our members, and the county offices will have that information as well. So there's going to be a couple of different ways that members will be able to get information, the Hoosier Farmer and the like.
I've got a couple of residence-related questions. The first is the coverage good for traveling outside of Indiana and even travel abroad? And then another question is for dependent college-age students who attend a school in a different state.
Yes.
Are they covered?
Yes, absolutely. So that residency question was really about you need to be an Indiana resident to apply for coverage. So that is only for the application process. The network is broad. You would have coverage outside of the state of Indiana. It would work in foreign travel. It would cover your college students that are in another state. All of those things would be very similar to what other kinds of health coverage that you would be used to. It's only that residency for the application process that really is the necessary piece.
Any other questions? We've got, let's just take a look at the timer. We've got about 18 minutes yet that we can cover some more topics if you'd like.
Just waiting to see if any pop up in the chat. And Megan, you said that enrollment will be rolling, correct? Okay.
Megan, just you've probably touched on this a number of times. I know we did through the legislative effort, but this isn't just a new concept. This has been proven in other states. Can you give us a little history on this? And because we don't want to, we want to make sure that it's a it's a product that's proven. So give us a little history on how this has worked in other states.
Yes, so Tennessee Farm Bureau has been offering these kinds of health plans for over 70 years to their members. And so they have a long history of doing that. And they have partnered with a couple of different states to really approach this option. Kansas Farm Bureau is currently offering these plans. They launched those in January of 2020. So they did their legislative session and then had a very similar session or process to us. And Iowa is currently working with Tennessee Farm Bureau as well. And Michigan is as well, but they're not going to be able, they're not doing the traditional health plans. Theirs is more the Medicare supplements. So there are a few other states that are working with Tennessee to offer these plans.
All right, it looks like we don't have any other questions in the chat. So I think we've got everything answered.
Yeah, last call for questions.
Yeah.
Well, again, Megan, really appreciate you jumping on and providing the information that you can at this point. We'll continue to work with the Indiana Farm Bureau to help push out the information as it is developed through our channels, through our Grower News publication. Perhaps we could do a story in our quarterly magazine that once the details are firmed up and you're able to provide additional information, that option is available. So again, we'll continue to work with you on this project, but again, on other issues, it makes sense for the ag groups to stand together. There's not a whole lot of us out there, so it's important that we have each other's backs when we are working on these legislative efforts. So again, thank you for taking the lead on this issue to provide this option for Indiana farmers. So just a few closing remarks. Again, thank you for taking the time to meet with us. We can't do the advocacy work or the lobbying with checkoff dollars. So we do appreciate your membership. If you are a member, we do appreciate that. I know we've got a number of our board members on. Again, Angie Steinberger, I believe Roger Balmer was registered. Tom Griffiths, I saw he was going to be on. Joe Steinkamp, Sarah Delbeck. I want to thank those individuals. We take they set the direction of the organizations. We, as staff, we take their lead, and we work on the issues that they see as important for Indiana agriculture, and particularly corn and soybean issues. We take their lead as staffers, so we do appreciate their work. And if you're not a member, we'd encourage you to consider joining. Advocacy groups like the Indiana Corn Growers, the Indiana Soybean Alliance, and also Farm Bureau are very important for the industry. You're very busy on your farm. You just frankly don't have the time to engage policymakers. We do that on your behalf. Farm Bureau, Soybean Alliance, and Corn Growers do that. We focus on soybean corn issues, take the lead on those. Farm Bureau is a general farm organization. They're able to work on other issues. So I'd encourage you to consider joining these groups. So is there another slide? Do we have some upcoming events we want to mention? We've got this webinar series we're going to continue. Again, we thought maybe we'd be having in-person meetings kind of back to normal by now, but we're going to go ahead and continue the webinar series. We're going to offer a webinar hosted by Dr. Alan Gray of Purdue. Just give us a look at kind of what kind of hit we took through this pandemic and what he sees coming in the next 6 months, 5 years, just kind of an outlook type session. We're going to have representatives from the grocery and restaurant industries to talk about how the pandemic changed the flow of our food, particularly meat products, how that shifted from restaurants to grocery, and how much of that's going to, in their minds, what do they see moving forward, how that's going to be a lasting impact, and as farmers, what do we need to do to prepare for that shift in the flow of our food. We're going to do a session on the Grain Indemnity Fund, what it is, what it isn't, how we stack up against other states. And then at some point, we're going to be working in a biofuels panel. Is there any policy efforts at the state level that we should be working on to increase biofuels production? And we're very fortunate to have FSA Administrator Ken Isley join us. I believe, Rachel, that's the 30th of July?
July 30th, yes. And
July 30th, that date is firmed up.
Yep.
We're going to just talk, and we're going to have representatives from the U.S. Meat Export Federation, the U.S. Poultry and Egg Export Council, and talk about how they are working alongside of the foreign ag service. It's foreign ag service. Apologize for that typo.
Sorry, typo on there. FAS.
Yeah, FSA is the one we generally work with, but there is the Foreign Ag Service, and Administrator Ken Isley will join and talk about their efforts to develop additional markets for our products, and grain in all forms. So that includes meat and egg, poultry products. We're building out our August summer shop talk series. And those are events that are held on farms, obviously in shops on farms, tool sheds. Those are very impactful. We get the members of Congress to join us on the farm. That gets us, kind of gets them on our turf, and our farmers are very at ease in these shops having conversations with our policymakers. And it also gives a chance to get those policymakers out to the farm and see the technology that we use and the volumes that we handle on the farm. And again, in a big event coming up at the Fouts Farm in Camden, Indiana, is the 100th year celebration of the American Soybean Association. The American Soybean Association was started on the Fouts Farm right here in Indiana. We're going to go back to that same location and celebrate the 100 years and also celebrate the next 100 years of the American Soybean Association. And I believe Mike Beard just joined. Thank you, Mike, for your leadership and for being able to pop on for a little of this. I know you had a prior commitment. So anything else, Rachel? I think
that is everything. That's our show.
Thanks again, and be looking for other topics. And if you have ideas for subjects you'd like to see covered in the webinar, let us know. Thanks
for joining us today, Megan.
Have a good day. Thanks, Megan.